Can alcohol trigger epilepsy seizures? Imagine enjoying a social night out, but for someone with epilepsy, drinking alcohol can be more complicated than it seems. Alcohol does not directly cause epilepsy, but it can trigger seizures in certain situations. The relationship between alcohol and seizures is quite complex and depends on how much is consumed, how often, and the person's individual health. Heavy drinking or binge drinking, which means consuming large amounts of alcohol in a short period, can increase the risk of seizures. Studies show that many seizures related to alcohol happen within 12 hours after stopping drinking. This is especially true for people with genetic forms of epilepsy, but it can affect others too. Interestingly, moderate or occasional social drinking usually does not significantly raise seizure risk for most people with epilepsy. Still, it is important to be cautious and discuss drinking habits with a healthcare provider. Another important factor is alcohol withdrawal. For those who drink heavily over a long period, stopping suddenly can cause withdrawal seizures. These seizures typically happen within 6 to 48 hours after stopping alcohol and can be quite severe. Withdrawal seizures are different from epileptic seizures but can look similar. Medical treatment during withdrawal often involves medications called benzodiazepines to prevent seizures and manage symptoms. Alcohol also affects the brain in ways that can influence seizure activity. Initially, alcohol might suppress some abnormal brain activity, but during withdrawal or after heavy drinking, the brain can become more excitable. Animal studies support this, showing that alcohol intake and withdrawal can increase seizure frequency and cause changes in the brain associated with epilepsy. There is also some evidence suggesting that alcohol abuse might be linked to a higher risk of sudden unexpected death in epilepsy, although more research is needed to fully understand this connection. For people with epilepsy, the safest approach is to avoid heavy or binge drinking. If someone chooses to drink socially, it should be done cautiously and discussed with a healthcare professional. It is also vital not to stop drinking suddenly if they have been drinking heavily for a long time, as this can lead to withdrawal seizures. In summary, alcohol can indeed trigger seizures in people with epilepsy, especially when consumed in large amounts or during withdrawal. Moderate drinking might be less risky, but it still requires careful consideration and medical advice. Managing alcohol intake is an important part of living well with epilepsy and reducing the chances of seizure triggers. Always consult your healthcare provider for personalized guidance to keep your health and safety a priority.